Actoplus Met Tablets are a combination medication containing two oral antidiabetic agents, pioglitazone, thiazolidinedione, and metformin hydrochloride, biguanide. It is used to improve glycemic control in adults with type 2 diabetes mellitus when diet and exercise alone are not sufficient. Indications: Actoplus Met Tablets are indicated for the treatment of type 2 diabetes mellitus in adults as an adjunct to diet and exercise to improve glycemic control. It is typically prescribed when monotherapy with either pioglitazone or metformin is not adequate for glycemic control. How to use: Actoplus Met tablets should be taken orally with meals to reduce the risk of gastrointestinal side effects. The tablets should be swallowed well and not cracked, split, or chewed. The dosage of Actoplus Met tablets is individualized based on patient's glycemic response and tolerance. The usual starting dose is 1 tablet once daily with meals, gradually titrated based on glycemic response up to a maximum recommended dose of pioglitazone 45 mg, metformin 2550 mg per day. Contraindications: Actoplus Met tablets are contraindicated in individuals with known hypersensitivity to pioglitazone, metformin, or any components of the formulation, severe renal impairment, metabolic acidosis, including diabetic ketoacidosis. Special instructions: Patients should have renal function assessed before starting Actoplus Met therapy and periodically thereafter. The dosage of Actoplus Met should be adjusted or discontinued in patients with impaired renal function to reduce the risk of lactic acidosis. Liver enzymes should be monitored periodically during Actoplus Met therapy as pioglitazone may cause hepatic injury. Patients should be advised to report any signs or symptoms of hepatic dysfunction such as nausea, vomiting, abdominal pain, fatigue, dark urine, or jaundice. Pioglitazone, one of the active ingredients in Actoplus Met, may cause or exacerbate congestive heart failure. Patients with a history of heart failure should be closely monitored during treatment. Side effects: Common side effects of Actoplus Met tablets may include hypoglycemia when used with insulin or sulfonylureas, nausea, diarrhea, edema, weight gain, headache. Less common but potentially serious side effects may include lactic acidosis, liver injury, and heart failure exacerbation.